evening, partners. Welcome back to PWT Rely News with your host, Mosey Along. And tonight we review Sunday, and we're talking about the unplanned medical care costs that y'all don't know a clue about. We take y'all to the stories that matter to retirees, families, and everyday Americans, and we break them down into plain English so y'all understand. And tonight we're looking at a report on the hidden Medicare costs that most retirees never see coming until it's too late. Most people believe Medicare is y'all safety net. That once you turn 65, your medical costs are mostly covered. But that ain't the real truth. No sirree. A new analysis shows the average 65-year-old may need $172,500 in savings just to cover health care in retirement. Why? Because Medicare leaves retirees exposed to a list of hidden expenses that ain't obvious until your bills arrive. Let's take a closer look. Hospital costs. Medicare Part A, the hospital coverage, is not free care. There's a $1,736 deductible every time you enter a new benefit period. Here we go again. Lights flickering. Thunder thundering. More like crashing. You would think we would get used to it. Here we go. Thankfully, a hush period. After 60 days in the hospital, daily charges jump to $434. And after 90 days, they rise to $838. And here's the part. No one needs to tell you there's no out-of-pocket maximum under original Medicare. That means a long hospital stay can drain your savings fast. This is one of the biggest financial shocks retirees face. Even basic Medicare coverage comes with monthly bills. Part B, $202.90 per month. Part D, around $39 per month. And these premiums rise with y'all income. A retiree who withdraws too much from a 401k or an IRA can trigger IRMAA surcharges, adding hundreds of dollars per month to their premiums. One financial misstep can raise your healthcare costs for an entire year. Original Medicare covers 80% of approved medical costs. Retirees pay the remaining 20% with no cap. That means cancer treatments, surgeries, specialist visits, outpatient procedures all come with a 20% bill attached. This is where many seniors fail and fall into medical debt. Medicare then isn't your instant coverage. It does not cover dental care, vision exams or glasses, hearing aids, routine foot care, long-term care. And these are some of the most common and expensive needs for older adults. A single dental procedure can cost more than a month's Social Security check. And this is one of the most painful coverage gaps in the system. Part D drug plans can change their pricing mid-year. A medication can move to a higher tier. Co-pays can increase. Coverage rules can shift. Retirees often discover these changes at the pharmacy counter, not in advance. The instability is a major issue in Medicare coverage. Even I just recently learned that the pharmacy I used was no longer covered under my supplemental insurance, and now I have to change midterm. Yes. If you travel outside the United States, original Medicare does not cover your medical care. Retirees must buy separate travel insurance or risk paying out of pocket. This is a major blind spot for anyone planning to travel internationally in retirement. Go check out Medicare travel limitations for more. There are ways to protect yourself. Medigap plans can cover deductibles, co-pays, and co-insurance. Comparing advantages versus original Medicare can help you find a plan that fits your needs. Elder locator resources can help low-income retirees find assistance. And most importantly, plan healthcare into your retirement budget early. Knowledge is power, and in this case, it's also protection. This has been We Review Sunday on PWT Rely News. Medicare is a lifeline, but it's not a full safety net, and retirees deserve to know the truth before the bills arrive. If you want the full breakdown, resources, or help navigating your own Medicare question, there's our website, pwtrelynews.ki.nsta.cloud, and follow the links in today's segment. Mosey along, stay informed, stay prepared, and stay empowered. Have a good evening.